Hello, my name is Emily Chambers, and for this video, we are going to talk about the dislocation of the jaw. I actually dislocated my own jaw in early December 2016, so I've had some experience with dealing with this type of physical injury. So let's begin the video. So what is a dislocated jaw? A dislocated jaw is related to the temporomandibular joint, also commonly referred to as the TMJ. It is similar to the shoulder or hip joint, as it is considered a ball and socket joint. The TMJ is composed of the temporal bone, the mandible condyles, which is a ball-like part of the jaw, which forms the joint on both sides of the skull. It is also composed of the articular disc that moves with the condyles when the mouth opens and closes. A jaw is classified as dislocated when the TMJ becomes disconnected from the skull and slides off the disc. A jaw can be dislocated on either one side or both sides of the skull. How can a jaw be dislocated? A jaw can become dislocated due to many reasons. There are two types of people who can suffer from experiencing a dislocated jaw. The first person is someone who has experienced a form of physical trauma to their face that could have been caused by the following: a car accident, a nasty forceful fall to the face, or any trauma by physical contact to the face. The second person who is more prone to dislocating their jaw is someone who has TMD, or temporomandibular disorder. TMD can be caused by arthritis, constant gum chewing, stress, misalignment of the jaw or teeth, or grinding your teeth. People who have TMD are more likely to dislocate their jaw after dislocating their jaw from before. When a person has TMD, they are more likely to dislocate their jaw by having dental work done, eating, sneezing, or yawning, which is how I actually dislocated my jaw. There are four types of dislocated jaws: anterior, superior, lateral, and posterior dislocation. With anterior dislocation, the most common type of jaw dislocation and the type of dislocation I had, the jaw is stuck in an open position and the jaw is pushed forward. With a superior dislocation, the jaw is pushed in an upwards motion, as most likely the person had their mouth open at the time of injury. A lateral dislocation is usually accompanied by a fracture or fractures in the skull, as the jawbone is pushed away from the skull. And a posterior dislocation is caused when the jaw is moved backwards into the skull. Symptoms and complications of a dislocated jaw. The symptoms of having a dislocated jaw are inability to close or open mouth, drooling caused from inability to close mouth, misalignment of teeth, difficulty speaking, a loud crunching noise located near the area of the ear, and excruciating pain. There are two different types of complications which can be either short-term or long-term. The short-term ones are muscle tension, headaches, pain in the neck, jaw, or face. The long-term ones are depression, hearing sensitivity, lack of sleep, swelling, and facial asymmetry. What muscles and bones are affected? The bones affected are the temporal bone, which is one of the bones that forms the skull, and the mandibular bone. The muscles affected are the lateral pterygoid muscle, which is responsible for opening the jaw, the temporalis, medial pterygoid muscle, and the masseter muscle, which are responsible for closing the jaw. When the jaw becomes dislocated, the jaw muscle spasm, causing the jaw to be in an open or closed position. How is a dislocated jaw put back into place? After being dislocated, a jaw should be put back into place as soon as possible, as the longer it is left, the more damage can be done. A jaw should be set back into place by a medical professional only, as if done incorrectly, the jaw can be put back into place into the wrong spot or it can be fractured. The jaw is typically put back into place manually. This is done by giving the patient pain relief, either using a sedative or a muscle relaxant. Then the jaw is put back into place using a reduction movement. The medical professional wraps their thumbs in gauze to protect them from being bitten down on, and then they place their thumbs inside the patient's mouth, pushing down on the back molars while pushing upwards with their other fingers that are placed under the patient's chin. The jaw cannot be corrected manually. Surgery would be used to place the jaw back into place correctly. Short-term treatment. After the jaw is repositioned correctly, x-rays should be taken to make sure there is no further damage to the mandibular and that the jaw is put back into the right place correctly. A Barton bandage can be used to support the jaw, relieve stress off the muscles and the TMJ itself, and to keep the patient from opening their jaw too wide. Pain relievers, anti-inflammatories, and muscle relaxants should be given after the jaw is relocated to reduce pain and swelling and prevent muscle spasms. Medium-term treatment. The patient should be on a liquid/soft food diet for 6 to 8 weeks after he or she dislocated their jaw. Some recommended foods to eat are soft dairy products, soups, mashed or baked potatoes, well-boiled pastas, canned fruit, scrambled eggs, and canned meats. The patient should also not open their jaw widely for 6 to 8 weeks. As soon as possible, the patient should also be sent to get an MRI to determine whether the articular disc was warped when the jaw was dislocated, so further treatment can be planned. Long-term treatment. The shape of the articular disc determines what types of treatment is needed for the individual. If the shape of the disc remains unchanged, the person will not need any further treatment other than heat or ice packs, and to be cautious of opening their jaw too widely. If the articular disc is damaged, further treatment such as injections like Botox, and for extreme cases, surgery may be required. Physiotherapy. Another type of long-term treatment is physiotherapy to help strengthen the jaw. Exercises should be recommended by a registered physiotherapist, but here are some examples of exercises that might be recommended. For the first exercise, place your fist under your jaw. Attempt to slightly open your mouth carefully while applying pressure. Hold for the recommended amount of time and repetitions recommended by your physiotherapist. For the second exercises, take 2 fingers and apply pressure while attempting to push your jaw forward. Hold and repeat for the recommended amount of time. For the third exercise, place your hands under your chin and gently apply pressure while trying to open your jaw. Repeat the recommended amount of times. Anyway, I hope this video helps. If you have any questions about my experience having TMD, feel free to leave them in the comments below. I will post the links to my sources in the description below if you want to check them out. Thanks for watching!